Good morning, this is Dr. Bill White again, and I'm going to talk to you a little bit about seared extractions, a little bit more. I'm a member of the American Orthodontic Society, and I'm happy to have you tune in and listen to our bies, and hope you can learn some things from it. Here we swap the bies for wisdom teeth in this particular case, and we did no orthodontic appliances at all. We just watched the case and extracted some teeth at the right time. We did this slicing technique on it and everything. So let's get into the case right quick, and it won't take too long to do this. This is I'm going to show it in several different ways. We started in 1972, and I'm going to show all the pictures right through till she grew up, And here we go again, and here is the adult young lady that we finished with. This was her models when we started, and this is the teeth. We'll go through here, and we did this reduction of the teeth. You can see back in here where we reduced the deciduous cuspids and let the laterals come in, also down on the lower teeth too. And here we go. And this is 1977, and this is 1990. Now somebody talked her into putting some facings on these upper central anterior teeth, which to me detracted from the appearance of them, but I didn't have much to do with that. But I sure wouldn't have done it if she had inquired about it beforehand. All right, here is 1974, and this is 77, and this is the facings that were put on. And the last time I saw her was in 1990, and again 74 and 72. And this is a bad picture, but the only one I've got. That's 1990. And again, the teeth here. And then you can see in 77. Now in 90, you can see the facings. They just bonded or fixed on front of the teeth and made them thicker. And I personally think it detracted from the appearance of the teeth. Now, we had no orthodontic appliances in there at all during the whole case. Now, here's 72, and we were crowded down in here, so we reduced these cuspids and brought those front teeth in, and we did a little bit of that on the upper also. And there it is later on where we had reduced this, and these teeth lined up good. Now this is nature. I mean, she didn't have any functional problems. She breathed through her nose. She used her tongue properly and everything, and it just pushed these teeth into place. You saw how they looked before, and lined them up, and we just gave them some room, and they pretty well centered out in here. No appliances at all now. We're just doing a seared extraction procedure here. Let's get this. Now, we've taken, in this one, we've removed the bicuspids, and the second bie has moved up into this area. Of course, it was real crowded. We're going to show you the whole thing on x-rays and just at the end of the video here. And this is the, must have been about 77 or something like that. And this is 1990 when we did it. And here's the 6-year molar, the second molar, and the third molar back here on both sides, you see. And we are short a bicuspid here in the front. So I just said we're trading a bicuspid up here and allowing it to straighten everything else out, and the natural tongue pressure and the lip and cheek pressures and the way the person uses it, push those teeth in that position so they have no retention to it. The pressures that she had shaped those teeth. And so you can virtually leave them alone. And I would dare say that if you found this lady when she's 80 or 90, I bet her teeth are still straight if she's still got them. All right, here we go. We'll show you the x-ray. They were crowded and we could see, and we didn't know for sure about the wisdom teeth. At this time, we see the 12-year molars coming up here. No problem on that. And so we kind of figured on possibility of doing this. And now we see how crowded they are, so we're going to reduce those deciduous cuspids. And you can see that it was 1972. Here it is in 74, I believe. And we had reduced the cuspids, both upper and lower, and allowed these teeth to erupt into place. And now we're going to see in this is 75, we took the baby teeth, those reduced teeth out, and now we've got a problem with the cuspids coming in. Now this is not extremely crowded. We could have expanded this whole thing and brought those teeth in, but then we'd had to retain it too. So everything was going real good. She was functioning good, and the teeth were lined up. So we took out the bicuspids. You can see up here, and watch how these teeth come in. The second bies come in this area. Now by taking that out. Now here we are. I don't see the date on this picture, but anyway, the teeth have come in. This one's tilted, but then it will straighten itself up and come right on into there. Here is 1977. All the teeth are in there. The wisdom teeth, we can see these right here. All the wisdom teeth are there. We could see them, actually, a little sign of the tooth, a little circle in there before we actually did this. So this is the fifth Panorex that we've taken on her. And now here is 79 or something like that. And it's not real plain, but this one, number 70, Panorex, we can see all the wisdom teeth now back in here coming in fairly good. Now we sacrificed something here and it allowed us to straighten this out. We had no functional problems. The tongue, the lips, and the pressure of the tongue thrust and all this was normal, and the pressure's normal. So we sacrificed teeth up in here rather than expanded to bring it in. It looks all right. And the natural thing of nature took care of that. All right, here for the wisdom teeth. And let's see, number 8. This is 1990 now. And we started this case in 1972. So from 72 to 82 to 90, in about 18 years later, here are all the wisdom teeth in place. Now these facings on here I do not like, but they got stuck on there some way or another, and I didn't care for them. But we traded the bicuspids for the wisdom teeth. and you get a better chewing tooth back here in the deal. But you had to watch it and kind of know what you were doing in here. And we did no orthodontic appliances at all. And so you can do these things. So I hope you get some idea from this. This is the first cephalometric we took in 1972. And here's one in 1977. And I don't think we took one on the last picture. Here's the body though, and here she is. We've extracted the teeth. And here's her profile in 90. And that's about as good as you can get in my taste now. And here's again, we go through. And this is the young lady after we finished with no orthodontic appliances at all, just strictly watching this and providing some space when space was needed by reducing these teeth and doing those pulpotomies. And we saw we could not get them in without a lot of expansion. And she was bringing her wisdom teeth were forming. And so we decided to extract the bicuspids and make a try for it. Now, if it had not turned out nearly ideal, we could have come in and touched it up. And a lot of these cases, we started like this, and then later on they had them touched up and stuff like that. So thanks for watching, and I hope you pick up something from this. And it can work, and you can do it. So I'm going to say goodbye, and it's all just a week away from Christmas, so I hope you have a happy holiday and everything. So I'll talk with you later. Thanks a lot now for watching, and join our group and subscribe for our program here. So thanks a lot. Bye.